Hi, this is Reggie from Restore Plus Physical Therapy. With the pandemic happening last year and even up to this year, a lot of people have been working from home. I have a lot of patients and actually even friends that have been working from home since last year. And some of them are going back to work now, but a lot of them are still working from home. Some have told me that they are going to be continuing to work from home indefinitely, either because they chose to do so or their companies have told them to do so. So now one of the most common conditions that we have been seeing more that's related to working from home because of the pandemic is a lot more people are having sciatica pain. So to give you an idea, sciatica is inflammation or irritation on your sciatic nerve. The sciatic nerve, it comes from it's the nerves that come out of your lower lumbar, and sacral spine that combines into form one thick nerve, and they travel from the lower back going through that kind of like the buttock area, back of the thigh, going all the way down, the leg and foot. So it's a very long nerve. It's actually the longest nerve in the body, and it's a very thick nerve. It can get irritated pretty easily if we're doing a lot of sitting at home. So in this video, I want to share with you what are three things that you can do to help prevent or actually treat that pain if it's being caused by sciatica, especially if it's related to that prolonged sitting. The most common cause of sciatica is irritation from the piriformis muscle, which is a deep muscle in your buttock area. Now you can see the relationship there is because when you're sitting for long periods of time and you're not really moving, a lot of times the chairs that we have at home, they're not really the best chairs. They're not ergonomic. We just improvise because we're working from home. We don't have the space. We just have to do what we have to do to get work done. So I have seen patients getting that irritation from the piriformis, and then that irritates the sciatic nerve. They're starting to have pain either the buttock area, the thigh area, and sometimes even to the going down to the foot. So what are the three things that you can do to relieve the pressure off of that piriformis or off of your buttock area? Because once you relieve pressure off that nerve on that area, or the buttock area or the piriformis, it will help decrease the pain, because it will help get that, it will help your body decrease the inflammation there. Less irritation, less inflammation, then you're gonna have less pain. That a lot of my patients tell me, so how can I do that? I have to work, I have to sit, I have to get stuff done. I understand that. So these are three things that you can do. One is, I would recommend, if you're able to, do stand up. So you can either use standing desk at the office. Very commonly, patients, and especially if they have the work area, they're able to do that. At home, not as easy. But what you can do is, what I recommend to all my patients with having back and back issues, sciatica issues, is I want you to stand up every 15 minutes. So get a timer. They have apps for that, free apps. I have patients who have downloaded free apps, either from Apple, Android, anything. Just get a free app that gets you a repeated timer. So what you want to do is set it for every 15 minutes is gonna give off an alarm. So every 15 minutes you have to get up, right? From your sitting position, you're sitting on your couch, you're sitting on your dining chair or whatever, or a computer chair. Every 15 minutes you get up. If 15 minutes is too intrusive, it doesn't, you can't get work done with that, you can do extend it to every 30. For my most acute patients, more severe patients, I recommend sticking to 15 minutes. If they're not too bad, they can do 30 minutes. Or for, let's say for maintenance, I would, or for preventative, I would go with every 30 minutes. Set it and then make it go off. So that's one. Now the second one that I want that you can do is, have you seen those? They have egg crate mattresses. They use that a lot to prevent bed sores. We used to, when I worked in the hospital many years back, we used to use that to prevent bed sores if patients are bedridden, or if they're on a wheelchair. If they're on a wheelchair and they're sitting there a lot, we use egg crate mattresses or those cushions. It distributes it creates some air there, distribute the weight so that the pressure won't be in one spot all the time. It won't hit those piriformis, and it won't hit that sciatic nerve. So that's number two, is you can use those egg crate cushions, egg crate mattresses. Now the third one that I would recommend is using an exercise ball such as this one. They have different different sizes, so it depends on how big or small, or how big or small your area is, how low, how high your desks are. You can use appropriate size. So let's say, for example, this one, I put it down here. So this will actually it takes a little bit of it takes a bit of getting used to. Make sure you're safe. You're not gonna fall, sideways, backwards. But it's once you're used to it, because you have your feet on the ground, so it's not that unstable. Okay, you can sit on it and then you can type away, work on your computer or something. Good thing is, because then it's air, it doesn't create that pressure on where the ischial tuberosity is, like in the buttock area here, where it can irritate the sciatic nerve, and where it can irritate those piriformis and make it tight and then cause that pain. So you sit like this on it, and then if you feel like, oh, you know what, you can actually move it side to side once in a while to distribute the weight. But just even sitting on it like this will be very helpful already to relieve pressure off of your sciatic nerve, of those piriformis muscles there, right? So, and also the other benefit from this one is, because you have to balance, you're actually working your core a little bit, trying to stabilize yourself. So you're working on some core activation there by just tuck your stomach in, all right? And you can activate the core while doing this. So this is actually very beneficial. If you can ask me among the three, I prefer to do this one, to use the exercise ball. They're easy enough to get. They're pretty inexpensive. But you can use, if you don't have a space for this, you don't want this, you can do the standing every 15 minutes, or you can use the cushion. And try at least one of them. So that way you'll prevent having that sciatica pain, or if you have it, definitely I would recommend trying one of these, aside from seeing your therapist, seeing your specialist, to be able to give you exercises and to do some manual work so that they can relieve that pain. All right, so I hope I give you guys a good idea on how to relieve that sciatica pain when you're working from home, when you're sitting, or even when you're in the office. You can do the same thing, but when you're sitting for long periods of time. All right, so thank you very much for watching this video, and remember, I want you to like, comment, subscribe, and share this video so that you can help transform other people's lives. And let me know what you want me to discuss, because I want to get you healthy and pain-free. I'll see you in the next video.